Assalamu alaikum. So today we are going to look at the difference between marasmus and kwashiorkor, which is an important question. So the first thing that you have to know is that kwashiorkor is mainly a protein deficiency, whereas when you take marasmus is both protein and calorie deficiency. So which means a marasmic child is both deficient in protein and calorie. That's why it's very, very thin. It is like, a very skinny child. Whereas when it comes to kwashiorkor, mostly people think it's a normal child because the child usually has edematous, abdomen and legs, and therefore the child looks more healthy, and therefore people don't actually find a child with kwashiorkor until it's too late. So why is there edema? So in kwashiorkor there is albumin deficiency. So it is a protein, obviously. So reduction in albumin causes edema. Okay, and in marasmus you don't actually find edema. And then the third point is there is going to be severe wasting. So there's going to be pop belly, and then you're going to have moon face in kwashiorkor. So that means it's going to be pretty round. And then there is going to be monkey faces in marasmus. So the child has very thin, structured to bony face. And then when it comes to kwashiorkor, there is upper limb wasting. And then a marasmic child is usually very hungry. So if you give it marasmic child food, he will eat it with, there is increased appetite in a marasmic child. But whereas when you give food to a kwashiorkor child, the child will not be as much hungry. It will not have very good appetite. There is poor appetite in a kwashiorkor child. And then marasmus usually affects infants, whereas kwashiorkor it affects children from 1 to 5 years. And it is also usually called as the first child syndrome, the kwashiorkor thing. And then the hair and skin is pretty thin in a marasmic child. So because there is wasting, there is going to be calorie deficiency, protein deficiency, everything is deficient, and therefore it is very thin skin and hair. And when it comes to kwashiorkor, there is going to be flag sign. So half of the hair is going to be black and half of the hair is going to be white, like if you take a strand. So that is the flag sign. And then in marasmus, it is like marasmus is most common than kwashiorkor. So you can find more marasmic children than kwashiorkor. And marasmus also has good prognosis, and kwashiorkor has poor prognosis because marasmus, the child is also, he has a good appetite. You can treat the child, he will also eat, and therefore it is a good prognosis. Whereas in kwashiorkor, since there is protein deficiency, protein is a very important component in the body, and so therefore this kwashiorkor children with kwashiorkor usually have poor prognosis. So again, to give a recap, marasmus and kwashiorkor. So marasmus, the age that is commonly affected, it is going to be first year. That is the child in the infant is usually the most common person who is affected. And when it comes to kwashiorkor, it is the second and third years. That is like from 1 to 5 years, kwashiorkor is affected. And then weight for age is usually less than 60% when it comes to marasmus. And then it is 60 to 80% in kwashiorkor, and there is no edema in marasmus, whereas edema is must in kwashiorkor. And skin changes is less common in marasmus. So you've seen the skin changes. We've seen the skin, thin skin, patchy skin. So and then the hair changes. There is not going to be any type of hair changes in marasmus except thin hair, and there's going to be flag sign in kwashiorkor. Mental changes, the child is irritable in marasmus, and there's loss of interest in kwashiorkor. And then the faces, the monkey, the marasmus has M and M, so monkey like faces, and in kwashiorkor you have moon faces. And then there's going to be muscular wasting in marasmus, a lot of muscular wasting. In kwashiorkor you see some amount of muscular wasting. And then there can or there cannot be a liver enlargement in marasmus, but liver enlargement is sure in kwashiorkor. And then the appetite is good in marasmic child, as I told before, and in kwashiorkor there is going to be